The X-Cel Apex Keratoconus thin lens design incorporates what we term fitting forgiveness factors that will simplify the contact lens management of your keratoconus patients. This presentation outlines the simplified fitting steps of the Apex Keratoconus aspheric thin lens design. The unusual corneal topography of the keratoconus cornea requires a different gas-permeable lens fitting relationship than that of the normal cornea. The superior cornea usually has a more normal topographical appearance, while the inferior cornea is much steeper and irregular in its curvature. Therefore, the lens design chosen must be able to fit two very different curvatures at the same time, while providing clear vision and not disrupting the corneal integrity. The X-Cel Apex Keratoconus design accomplishes both of these tasks with its easy-to-follow fitting steps. Our proprietary Apex Keratoconus aspheric thin lens design is based upon the belief that in order for patients to be successful with GP lens designs, they must be fitted with a lens that minimizes apical interaction, avoids impingement of the peripheral cornea, specifically in the flatter superior quadrant, and places the optical zone over the pupil. In order to meet this challenge, the posterior surface has a spherical optical zone radius small enough to allow for tear exchange, yet large enough to provide good vision without excessive flare. In addition, the posterior lens surface has enough eccentricity to adequately align with the flattening seen in the peripheral keratoconic cornea. To handle the wide range of keratoconic patient needs, the X-Cel Apex design has an extensive parameter availability. Diameters are available starting at 7.9 to 10.3 millimeters. A full base curve and distance power range is offered, and the periphery can be adjusted to a steep, medium, or flat edge lift. And the lens is available in the 100 DK Boston XO material. Since the keratoconus cornea is often too irregular for K readings to be accurate, it is suggested that the X-Cel Apex design only be fit diagnostically and not empirically. A recent university clinical evaluation analyzed the fitting characteristics of the Apex design, resulting in the development of the Diagnostic Set. This evaluation included the fitting of 39 eyes with the Apex Keratoconus design, and all the subjects in this evaluation paid for their lenses and services as normal. The lenses were manufactured in the Boston XO material, which proved to be stable, durable, and resistant to flexure problems throughout the clinical evaluations. Since many keratoconus patients are unable to see adequately with their glasses and need to wear their contact lenses full-time, there is a benefit to corneal health utilizing a material with a DK of 100. The keratoconus patients were followed for a period of 6 months. The base curves fitted ranged from 40 to 65.5 diopters. The powers ranged from +4 to -23.5 diopters, and the diameters from 8.3 to 10.8 millimeters. 33 eyes were fit with a medium edge lift, and 6 eyes required a flat edge lift. The mean value of the lenses fit on the 39 eyes was a 45 diopter base curve, a -375 power, and a 9.3 millimeter diameter. Only 5 of the 39 eyes required a change in parameters following the dispensing of the original lens. Of these 5 eyes, only 2 required a change to different gas-permeable lens designs. All the remaining patients fitted with the Apex design completed 6 months of follow-up care, and at the end of the evaluation, vision, lens comfort, and corneal integrity were all satisfactory. The Apex Keratoconus lens design is easy to fit because it utilizes a diagnostic lens set. Evaluation with diagnostic lenses will improve success rate, reduce valuable chair time, and minimize lens parameter changes. A standard 24 lens diagnostic set is recommended, and an additional 10 lens set can expand the office fitting opportunities. For fluorescein pattern interpretation, a Ratten filter is included with the diagnostic sets. Let's review the fitting process. To determine the base curve, apply the mean diagnostic lens regardless of the keratometry values. This lens has a 45 diopter base curve, -4 power, and a 9.3 millimeter diameter. Consider the use of a topical anesthetic for patients who are not currently wearing gas-permeable lenses. blocking the reflex tear mechanism and using a Ratten filter provides for a more accurate fluorescein pattern. It is important to be careful not to apply too much fluorescein since an excessive amount can result in an inaccurate interpretation. If a constant black appearance is observed over the corneal apex, steepen the base curve until a lightening is observed during the blink. If the corneal apex is vaulted or a bubble is observed trapped beneath the lens, then the recommendation is to flatten the base curve. The next step is to evaluate the diameter. If the base curve relationship is proper and the lens centers, go to step 3. If a proper centration and base curve relationship is achieved but inferior edge standoff is observed, consider decreasing the lens diameter. If the lens is discentered, increase the lens diameter. And if poor tear exchange over the apex is observed during the blink, consider reducing the lens diameter. As a rule of thumb, change the diameter a minimum of 0.3 millimeters to make a noticeable difference. The apex design comes with a standard medium axial edge lift, which is included in the diagnostic set. Steep and flat edge lift values are also available in rarer circumstances where they are indicated. If there is insufficient edge lift, order a lens with the flat edge lift value. Conversely, if excessive edge lift is observed, order the steep edge lift value. Finally, perform a spherical refraction over the most appropriate diagnostic lens to determine the power to be ordered. In keratoconus, it's not uncommon to have some residual astigmatism due to the irregular cornea, but this cylinder component should not be incorporated into the apex lens design. To summarize the fitting steps, first evaluate the recommended 45 diopter -4 9.3 mm lens from the diagnostic set to determine the base curve. Next, evaluate the lens diameter, and in step 3, determine the desired medium, flat, or steep peripheral edge lift value. Finally, in step 4, perform a spherical over-refraction to determine the lens power. Based on your findings, you are ready to order the lenses. It's that simple. The properties of this design are intended to aid the practitioner in managing the various topographies seen with keratoconus. To maximize vision and minimize flare, the ideal apex keratoconus fit maintains centration of the spherical posterior optical zone over the visual axis. Our goal is to have minimum interaction of the lens and the elevated corneal apex. An established grip or fulcrum points along the horizontal meridian helps maintain centration of the lens. It's also important to avoid impingement in the peripheral and mid-peripheral cornea, especially in the superior quadrant. Impingement can reduce wear time and comfort, while inferior lens decentration and poor tear film replenishment during the blink cycle can result in epithelial breakdown. While our Apex diagnostic lens fitting system eliminates most potential fitting problems up front, in some cases it's still necessary to troubleshoot. To remedy a lens that isn't pulled up by the upper lid and positions inferiorly, consider trying a lens with a flatter base curve. If a lens decenters laterally, consider increasing the lens diameter to improve centration. And if proper centration is achieved but inferior edge standoff is observed, consider decreasing the lens diameter. If the patient experiences peripheral seal-off or lens adherence, loosen the fit by choosing a flatter base curve or decreasing the lens diameter. And finally, if the lens fits too steeply, choose a flatter base curve, and if the lens fits too flat, choose a steeper base curve. Try a pair today. The Apex Keratoconus lens design has a 90-day guarantee fit with 100% credit on 2 exchanges per eye and cancellation. Still not sure what to do? Call or email our experienced fitting consultants. We are eager to help you be successful fitting the Apex Keratoconus lens design. To order an Apex diagnostic set, call any of our 7 locations. Try a pair of Apex Keratoconus lenses today. Brought to you by X-Cel Contacts, innovators in GP lens design and manufacturing.